So my name's Kate Button. My background is that I trained as a physiotherapist.
So my name is Mohammed Al-Amri. I'm a senior research fellow at Cardiff University. My background is biomedical engineering. So in my PhD, I was more focusing on biomechanical engineering, where I becomes more like a clinical rehabilitation engineer. So at the current time, I'm focusing on how to use technology, specifically wearable technology and virtual reality in rehabilitation. And I'm mainly working on how to use this with patients with knee pain. And I have some interest also to use this technology for people with traumatic brain injury and generally with neurological conditions as well. I'm also leading a sensor physiotherapy intervention research group where we are aiming to research and to find out how to use the digital technology in movement science and rehabilitation. The EWWD project is one of the innovative projects I have come across over the past 10 years, which is trying to sort out one of the main issues in healthcare, which is to link clinicians and patients using wearable technology. And we know there is a number of wearable technology already in the market, but most of this wearable technology has not really been designed for the purpose of linking these patients, though they are being used recently in healthcare practice. So the EWWD is trying really to bridge the gap between what we have really been doing in the laboratory-based and into clinical practice. So this is where it's our role in Cardiff University come as a key things to deliver the EWWD to the good standard. So our role here is actually to guide and to lead the development of the biomechanical models, where it will allow people to measure quality of movement outside the laboratory. And we are leading with other partners the development of the innovative intelligent software, where it can detect all the biomechanical parameters that we usually collect in complex laboratory and outside environment, and even in home, in patients' comfort environment like homes.
So I've worked for many years as a physiotherapist within the National Health Service. And I've always found it really challenging to spend so much time trying to help people control their pain, help people to be able to do the activities they want to be able to do. I mean, doing this through prescribing exercise, giving people feedback about how they do their exercises and how they perform their movements. But the thing I've always found really frustrating and found there's been a big gap is the fact that physiotherapists can tell people about their movement and their exercise, but the patients can't take that home with them. So there always seems to be this gap in knowledge and understanding around what physiotherapists are saying and trying to demonstrate, and what people actually have access to at home. And so I am really excited to be part of this project, because to me, it's like we finally got the opportunity to be able to look at how people are managing their problem at home through how they move, and be able to give them feedback which can actually help them do their exercise, can actually help them be more active, and to be able to achieve what they want to achieve through learning about their movements, about using this technology to be able to give the best treatments and help decide what will be the best treatments for these people, to be able to allow them to self-manage and to, like I said, to ultimately to be able to live more healthier lives. So one thing I'm really excited about is the fact that all our previous research has happened within a laboratory setting. Because we need large, expensive equipment that's not mobile, and it's not accessible to the average person with a lot of the long-term conditions that we're looking at in this project, such as diabetes, musculoskeletal conditions. And so our previous work had been starting to take that technology out into the clinical setting. So we were making it more mobile. But what's really exciting in this project is that already the work has gone in to making this technology even more portable. So there's a whole big team of researchers, people who are experienced in computing and technology that are being able to take this wearable technology, and whereas we've been having to have large numbers of sensors that we place all over people's body to learn about how people move, already a lot of work has gone into reducing the number of sensors so that we can actually start to look at how people move, how people are functioning with just say 2 sensors on their body, which is a massive difference. And that's because people have been putting all this research and work into creating computer algorithms to be able to reduce the need to have many wearable sensors on people's bodies.
I think it has really been nice really to see now it's our laboratory based research that we have always been using in the lab. It has really become through this project to be translated into real life and to be in practice as well. So I can see so what we have really achieved so far within the past 6 months. I think it is amazing, because we have already now developed a model which is not exist now in any way, which is it allows us to calculate all the joint angles, using a couple of sensors rather than to use 17 sensors. Because we have thought in Cardiff University, we have done some work when we translated our laboratory research into clinical practice, but by using 17 sensors. Now, this is what we have done. It was really great step, but it didn't allow us to move beyond the clinical settings and beyond the complexity that it is still required to collect all these movement data. So far, what we have done within the EWWD, we have addressed this gap, and I found it really interesting to work with all the team within the EWWD from different disciplinaries, and just bring all these ideas together and make it real.
I think it's really exciting for physiotherapists to have the opportunity to work with the expertise and the range of expertise that is available through the EWWD project. Physiotherapy as a profession, it is changing. We're taking on new roles and our practice is expanding. We do a lot of work in rehabilitating individuals and trying to be able to support people to manage their condition long-term themselves. But we also take on a role now much more in diagnostics, assessing people and planning the long-term treatment plans. Working in new locations such as primary care and working outside of the hospital. And so, but we physiotherapists often don't have the knowledge and skills in technology, and certainly do not have the skills generally in artificial intelligence, machine learning, and probably even about what technology even exists that we could be using in healthcare and managing big data as well. And so the opportunity to be able to link with the EWWD is just really exciting. I just think that we can come up with the types of solutions that probably 2 years ago I wasn't even really thinking that we'd be able to do. And so I don't even think at the moment there's lots and lots of ideas. about how we're going to have an intelligent platform that's going to be developed to help support people. But I don't think we've even thought of all the solutions that we could actually come up with to help people. And I think that will emerge more and more as the project develops. What I can say is that, I have been discussing this project with my colleagues. Unfortunately, COVID has come along and probably, we haven't been able to get that out there in the same way in clinical practice and talk to our clinical colleagues about this project like we would have wanted to at this stage. But all I can say is there is a lot of excitement about using technology, even the current situation. What's really highlighted is that we need to get new ways of being able to support people in their home environment and take technology out into the home. And certainly from my colleagues, that I've talked to about this, there is a lot of excitement about the sensors, about really being able to now be able to achieve that. So I think probably for me, there's some slight unknowns about using using the technology within a healthcare setting. But actually, it might be really exciting, and what it might do is push us to quicker into the home environment and more community-based environments. So I think, as clinicians, we tend to be, quite focused on hospitals, health centres. But because of COVID, it's, you can see it as, oh my goodness, is that going to make it more difficult for us to be able to use this in healthcare because of space issues, of all of those kinds of things, and sharing equipment, those kind of things. But actually, thinking about it, it might actually be good because it will push us to look for new ways to do things. And I think that means it's going to push us quicker, like I've said, to the home and more community settings, which can actually only be better. So I've got two other challenges I think that we need to have a mind on. I think the first is remembering cost. So ultimately, we need to come up with a solution that is affordable within healthcare, either for the individual or for the health service, and looking at, how ultimately would our solution be rolled out, and what is going to be that model for ultimately getting it used to help people manage their conditions. The second challenge, I think, is also looking at how patients or healthcare professionals are going to use this. So time is always an issue. It's always an issue within delivering care. And I think there will need to be new working practices, probably around integrating technology. And so I think it's important that as part of this project, we are also exploring how ultimately healthcare professionals can implement this as part of their of the care they deliver. And actually, the other thing, as we've learned maybe a little bit within healthcare, is where do we need to improve the infrastructure to allow us to use technology.
From my perspective, I believe the main challenge is really it's like to use the right wearable technology, and it's also to provide and the purpose of using this wearable technology. I think for healthcare practice, I think what they want to monitor the patients and they want to improve the clinical outcomes. So, as I said before, there is a number of wearable technology available in the market, and it can be used in different formats. But all of these technologies or most of these devices available in the market have not really fit for purpose. And I believe it is important when we need to monitor the movement of somebody, we need to look at this in 3 dimensions, simply because our body moves in 3 anatomical motion. So there is no point to look only at 2 dimension, at most of, it's like what is going on in most of the digital technology we are using, including the wearable technology. So the most challenging part of using wearable technology is to use the right wearable technology. I think the last things we need to do is to expose our patients and even our healthcare practice with huge number of wearable technology that are useless, and they just provide simple information, which is it can be collected by using standard consumer devices like even mobile phone without really using anything else. I think this is the most, from my perspective, this is the most challenging part, which is to use the right technology. There is a legacy of COVID-19 in terms of like how we are going to use technology and how this technology going to be adopted, I think, within the healthcare system. So because we know COVID has changed everything and there is no return to business as usual. But I think the main things we learned during COVID, it's like the importance of technology and how this technology, especially remoting, how it's actually helped to improve or at least to keep the communication between the clinicians and their patients. So the only concerns I would have about this positive outcome from COVID, it's again, we will be exposed with a number of technology to use, and it might be this is where the EWWD is playing a key role in improving the healthcare practice by providing the right technology at the right time. With no doubt, COVID-19 has changed everything, and we know there is a number of people, especially a number of clinical services have been seriously affected by COVID, where they cannot see patients face to face, where even like physical assessment is really important. So these patients, they are more likely to develop, I think, some challenges in the near future, and or at least just let us to use the terminology post-COVID, because they did not really receive the treatment and the support they wanted during the COVID period, which is now it's expanding more than 1 year. And can you imagine like how these patients, the consequences of the lack of receiving treatment or physiotherapy during this period. Now, physiotherapy, I think in the UK, they tried to address this gap by introducing a number of approaches, including digital technology, is saying, for example, like video contact with patients, etc. But this is still because physiotherapists, they need some physical information. They need some information to assist these patients. And there is no technology at the moment exists to help the clinicians, specifically physiotherapists, to assist their patients remotely. So this is where I feel this technology, it's going to address this gap, and it's going to introduce a new approach, in improving the communication between the clinicians and patients without sacrificing the quality of the objective assessments that we have usually do in the lab. And I think this is here showing, it's again demonstrating the importance of the EWWD during this period.
Okay, so what I would see for the future from this project is hopefully what we'll see is obviously what we want to do is have better patient outcomes. So what I'd like to think is that we have more effective treatments and screening tools, and that results in better patient outcomes in terms of their function, in terms of the symptoms such as pain and general quality of life. Ideally, what we would also see is less reliance on hospitals, and that people feel they have better skills in order to self-manage their condition at home. And what I would also hope is that for healthcare professionals such as physiotherapists, that actually it will help to make our job more rewarding. Hopefully it can mean that people are more engaged in their rehabilitation and provides new opportunities for careers in the future, which which I think would be great for the profession as well.